Okay, welcome everyone. You are here at the Invisibly Aware Series. This is a series brought to you by the Invisible Illness Awareness Network. And today we're going to be talking about gastrointestinal conditions and what it's like to live with them. My name is Annika. I am a white woman with dark brown hair. Today I'm wearing a yellowish, off-whitish sweater with a collar. And I'm going to be moderating today's session with Morgan. Morgan, if you would like to introduce yourself.
Hi everyone. As Annika said, my name is Morgan. I am a white woman wearing a um, gray sweatshirt, and I have dark brown hair and a low bun.
So we are going to introduce our guest speakers soon, but first we would like to provide an access check. We will be giving verbal image descriptions of any pictures that we have, and then we ask that our guest speakers also give some verbal descriptions of themselves for anyone who might be vision impaired. We also have captions that are available. You can turn them on at the bottom panel by clicking the CC button. And if there are any other accommodation needs, please let us know in the chat or by emailing us for future meetings. We would be happy to try to find ways to accommodate anyone who would like to participate more. We would like to provide some important disclaimers before we get started. This is not medical advice. If you have any medical concerns, please consult your doctor. It's also important to keep in mind that every person with any single condition is unique. Even if you have the same diagnosis, your experience might not be the exact same as someone else with the same diagnosis. Keep in mind, we are not necessarily experts on these topics, but our guest speakers are experts on themselves and their personal experiences with these conditions. So what is the Invisible Illness Awareness Network? We are a 501c3 nonprofit that is dedicated towards raising awareness about invisible illnesses, chronic illnesses, and disability. We support students starting affiliate organizations at their universities to become leaders, educate their peers, and foster inclusive environments in their communities. What is the Invisibly Aware series? That's where you are right now. The Invisibly Aware series currently holds one virtual event a month on Zoom with a different topic every month. This event has guest speakers who share their lived experiences or professional experience on the topic at hand. Here are our social media handles. We have the Invisible Illness Network on Instagram, Invisibly Aware Series as well, and a YouTube channel where you can see our past videos with our guest speakers at IIAN Network, as well as iiannetwork.org is our website. And you can scan the QR code to find our link tree for more links, including our newsletter sign up for those who are interested. Feel free to ask questions as we're going in the chat. We will answer all questions to the best of our knowledge, and keep in mind that we will have a dedicated time at the end to answer any of those questions. So now I will turn it over to Morgan, who's going to give us some background on the conditions that we're going to talk about today.
Alrighty, so the first condition we're going to be talking about is celiac disease. And so this is an autoimmune condition that develops in response to gluten in the small intestine. And so when there is gluten, the villi in the small intestine will become damaged. And as a result, that can create a lot of issues with absorption and malnutrition as well. And so the main symptoms of this condition can be diarrhea and constipation, nausea, weight loss, abdominal pain and cramping, brain fog, and fatigue. Some of those complications from that damaged villi can include malnutrition, anemia, bone density, lactose intolerance, and higher GI cancer risk. And unfortunately, the only treatment for this condition is following a strictly gluten-free diet. And so that can be in any amount. Contamination can happen if bread were to touch a and then another food is to touch that same surface. So it's very important that they follow, again, a very strictly gluten-free diet. And sometimes people even have service dogs to help with the identification for gluten in their diets. The next condition we're going to be talking about is gastroparesis. And so this is the partial or complete paralysis of the stomach muscles. And this paralysis can slow or completely stop gastric emptying, so the food cannot pass through the stomach properly. This causes a variety of symptoms, mainly nausea and vomiting. It can also cause bloating, early fullness, also known as early satiety, constipation and diarrhea, fatigue and pain. Complications similar to celiac disease, it can result in malnutrition, but it can also lead to dehydration and food blockages from, again, the food having an inability to pass through the stomach. For treatment, dietary adjustments are the main recommendation, and that includes following a low fiber and low fat diet. If this doesn't work for people, then medications can also be used to increase motility, reduce nausea, and help with pain. In severe cases, feeding tubes or IV nutrition may be considered as well. And then lastly, we have intestinal failure here. And so the intestinal failure is when the gut is unable to meet the nutritional and fluids needs, normally due to there being either not enough of the gut, like the length of the gut is not long enough for it to work, or there's some damage in the gut that stops it from working properly. It can be caused by several conditions and comorbidities, but the most common is short bowel syndrome. It can also be caused by Crohn's, celiac disease, gastroparesis, liver disease, and other conditions as well. Intestinal failure is very severe and it can cause a lot of symptoms and complications, most notably bloating, diarrhea, vomiting, fatigue, malabsorption, poor appetite, and weight loss. And these symptoms and issues can lead to complications such as malnutrition, dehydration, liver disease, infections, kidney damage, and blood clots. For treatments, there are some medications similar to gastroparesis that can help with the motility and help control for pain. TPN, or total parental nutrition, is one of the main methods they use to manage this condition to provide nutrition for people who have intestinal failure. And that is that IV fluid that was mentioned in the previous slide. And then some cases, a small bowel transplant may be considered as well to help add to the mass of the gut to allow more absorption of nutrients. Alrighty, and then so we're going to have a couple guest speakers tonight who currently live with these conditions and are hoping to share about their experiences and provide them our insights. So firstly, we have Casey Cromwell, who you can find at College Celiac KC on Instagram. You can also find her at the same TikTok handle, and she also has a website, glutenfreewithkc.com. And then we have Larry Dorame, and you can find him at Larry's Fight on Instagram. So we're going to go ahead and transition into our panel here. So if each of you guys wouldn't mind just taking a quick second to introduce yourselves and maybe give a little brief background on a little bit about yourself.
So my name is Casey Cromwell. I am a white female with around shoulder length brown hair and glasses, and I was diagnosed with celiac disease over 12 years ago now when I was 17 and just about to start college. And especially since that was back in 2013, there really wasn't a lot of information on how to be gluten-free in college or just as a young person in general. So I decided I'll start a blog, and I never expected to keep doing it for 12 years, but here I am.
Wonderful. Thank you, Casey. And then Larry.
Hi, my name is Larry Dorame. I'm a Hispanic male with short black hair, glasses, and wearing a button-up blue shirt, collared shirt. I was diagnosed with cancer 14 years ago, which ultimately led to, because of that cancer treatment, led to the diagnosis of gastroparesis, which unfortunately has progressed to intestinal failure and multiple surgeries and multiple complications along the way. But I'm honored to be here and share my story.
Well, thank you both so much for being here and again, taking the time out of your evening to share about your experiences and help us learn a little bit more about your condition. So I'll go ahead and pass it over for our first question here.
Okay, so again, thank you so much for being here and for being willing to talk about your experiences. I was wondering if we could just start out with a brief overview of what it's like living with your condition, the day-to-day, and how this condition affects you in your daily life.
I can go first. I think one of the misconceptions about celiac disease is that you pretty much, sorry, my cat just decided to join the chat. This is Professor Snuggles. But I think one of the misconceptions is that you just have to switch breads. As long as you just go to gluten-free bread, everything is super easy. You don't have to worry about anything at all. But like you mentioned, there is an issue with cross contact, so that makes it really difficult to ensure that things don't come in contact with gluten. And there are even things like gluten can be in medications or lipsticks or anything that you put in your mouth or on your eyes that could be ingested needs to be gluten-free. So pretty much all of my existence is for checking labels. And even if I bought something like 20 times, I still have to check the label because it could change without warning.
So for me, living with intestinal failure, gastroparesis has actually been quite a learning experience because when I was first diagnosed, which took a very long time to be diagnosed, I'd never heard of it before, and I didn't know how to manage. All I knew I was vomiting constantly, things weren't moving. Um, so we thought it was easy as taking uh, acid reflux medication, which didn't do anything, and in some instances made things worse. So we kept, much like celiac disease, we kept trying to troubleshoot with different foods to see if that would work. Um, and you have many, especially GI doctors, because this isn't something that's familiar, especially in a younger individual with that who doesn't experience diabetes. Um, let's just try different antacid motilities. Let's try different foods. Let's try softer foods. When things continue to not work, it was finally until our third GI doctor said, had you ever tried a gastric emptying study? And again, we thought it was all cancer related, and it ultimately was. But realizing at 240 minutes, 90% of the food was still stuck in the stomach. And unfortunately, that led to a gastric pacemaker, which failed, which then led to getting the stomach removed, which failed. And then they realized this was a global issue. So fast forward to getting not only the stomach removed, the colon removed, and getting an ileostomy and a feeding tube, which all those ultimately ended up failing as well, and having to go on TPN, which was then diagnosed with intestinal failure. So my entire journey has been a trial and error. And like many, there is no cut and dry answer to find out what is perfect. Um, but ultimately, my wife and I advocating for myself to be able to get the proper doctors, and still to this day, trying to figure that out. So for me, I'm sure like Casey, it's continuously advocating for yourself and doing your own homework. Because if you don't, the way the medical system is today, you fall through the crack. So that's it in a nutshell for me.
Wow, thank you so much for sharing. And I think a lot of people can agree with and echo the experiences that you both shared about having to really advocate for yourself and always kind of having to think, oh, what about my condition? What do I need to do to manage it? And what else out there could I be trying? Do I need to be trying? And all of the thought that goes into just managing these diseases. So thank you so much for sharing. And I know, Larry, you just touched on this a little bit, but I think we're curious to also hear a little bit more specifically about both of your all's diagnoses journey. So maybe things about how long did it take for you to start seeking help after seeing your systems? How many doctors? Did you have any particular emotional reactions to getting diagnosed, maybe before or after?
I was lucky in some ways in that my main symptoms at first seemed very mild. I was having a lot of acid reflux, I was losing weight, and I wasn't really concerned about that because I was 17. I was more concerned with my prom coming up, with my soccer I'm doing, and it was really my mom who got on me to go to the doctor. And I was very fortunate that my doctor was overly anal and just ran blood tests for everything, including celiac. So that's really how it first showed up. And no one in my family had been diagnosed with it. We didn't even know I had the genes. So I think my first reaction was really like relief because I do also have fibromyalgia and I was diagnosed with that at 11. And at least when I got this celiac, where I was like, oh, there's some kind of treatment. It's not just a lifelong condition. I could go gluten free, even though I had no idea what gluten even was. But I knew that that could lead to answers. But I think one of the hardest things that isn't really talked about in the celiac community as much is that complications can happen and your symptoms can go from mild to severe very quickly. So I was diagnosed like in May, And I went gluten-free, but unfortunately, I had what I now know is delayed response celiac. So my system did not respond to going gluten-free. I continued to lose weight. I continued to have symptoms and have a lot of pain from eating. And a lot of doctors, unfortunately, especially with my age and my demographic as a young white female, just thought she has an eating disorder. She's choosing not to eat. And it really wasn't until I found a female gastroenterologist who really took my symptoms seriously. And she was the one who ended up hospitalizing me for malnutrition after my 18th birthday. And I was on a feeding tube for a couple of weeks. And for me, that ended up basically saving my life and allowing my system to get enough nutrients without being inflamed by having to digest food to slowly heal and to eventually be able to eat gluten-free without pain. So I think originally I was very relieved when I got the diagnosis, but there was a lot more fear once I was not responding to a diet like most doctors assumed that I would. And there is, if you are interested in upcoming celiac research, there is new research that came out this year that many with celiac do have what they consider an immune scar in our intestines, which can cause existing symptoms even on a gluten-free diet. So doctors are still learning a lot about how gluten-free is not just this easy cure for celiac disease. A lot of celiacs do need more assistance than just that, and I really hope that our healthcare can start doing that better.
So for me, my journey started 14 years ago. At the time, I was 22 years old, and I had it, somebody who didn't smoke and who didn't drink, besides socially, had a difficulty swallowing. I literally had to remind myself to swallow, and I thought that was odd. So went to a primary care doctor. Said, your tonsils are a little inflamed. Let's send you to an ENT, and maybe that's the only issue. The ENT looked and he goes, "Yeah, the tonsils are inflamed. Let's go ahead and let's just take them out." Uh, Woke up from surgery and he said, I don't think it's anything, but I found a spot at the base of your tongue when I was doing the surgery, sending it off to pathology. We'll get back to you." Got a call not even 2 weeks later saying, "Hey, you've been diagnosed with throat cancer. We need to start you. We believe we got most of it out, but we need to start you on chemotherapy right away." So we first started with an IV agent of chemotherapy. Then shortly after about 3 months, it was a very short stint of treatment. We thought I was good to go. Unfortunately, numbers roared back pretty quickly, and they decided to go at a more targeted approach, was an oral chemotherapy. That took care of it. But then about 10 months later is when I started having all the GI symptoms. And it was again vomiting, it was bloating, it was the reflux. They weren't really sure what was going on. As I mentioned earlier, they started putting me on these different modalities of medications. Um, but I was constantly feeling bloated. I was constantly feeling sick. And the nausea seemed to get worse day in and day out. And so after, like I said, three different GI doctors, I finally had one who said, have you ever had a gastric emptying study? Uh, Again, no reason. Most people, again, gastroparesis is kind of rare in someone who's young, and those who are diagnosed with it, typically it is along the lines of having diabetes as their first diagnosis that then develop gastroparesis. So it's kind of out of the woods for me of that being that. But after that, I remember the day of eating a radioactive egg and laying in the bed and under the X-ray for 6 hours. They came back and said, after 240 minutes, 90% of that radioactive egg sandwich is still in your gut. Um, so they immediately, and I remember going home and I was vomiting for 3 days straight after eating that egg. We tried different things like Reglan to try to get the and domperidone, which actually isn't improved anymore in the United States. We have to get it from Canada, um, which is very sad because it worked really well. But the United States has decided to black box it. We're still trying to hope that we can get it, but doctors have done a workaround where they give you a script and you can order it and bring it back to the States. Um, that worked for a while. Unfortunately, it did stop working after about a year, and things continue to get worse. So they decided to place a feeding tube, and I was doing tube feeds for the longest time. That also began to fail because the feedings started to back up and settle in the stomach. So we decided to do something radical, and we did a fundoplication as well as a they never heard of it in my wildest dreams, and never would have thought this been the case, but they did a gastric pacemaker. So think about a pacemaker for the heart. They attach the leads to the stomach to force it to pump, and that actually did work for about 8 months. But unfortunately, when they tried to go and replace, just do a routine tube feed replacement, the leads detached. So it required two open abdominal surgeries to get that to fix, which continued to make things worse. So they ultimately ended up removing the stomach. And then shortly after found out that things weren't working. And this was going through multiple doctors. Finally, in 2019, they had told my wife and I that it was the end of the road, that I should consider going on hospice. There was nothing more that we could do. I had exhausted all the options. And my wife, luckily, as a PA, said that can't be the only option. And she scoured the entire country. And this is again going back to having advocates in your family or your friends. Um, she found that Cleveland Clinic was one of three intestinal transplant departments in the entire country, and they accepted my case. Uh, and fast forward about 3 months, they decided to do a radical surgery where they removed the remnant stomach, the colon, gallbladder, appendix, and some of the small intestine, and that seemed to work. They had to that Then I became reliant on TPN. Um, Worked for a while. Unfortunately, more my intestine has died off. So in January of this year, they removed more of that small intestine. So I'm in between tube feeds and TPN. But again, there's a whole nother set of issues because I've had so much removed. I suffer now from iron deficiency anemia, and also severe immune deficiency issues. So that comes with a whole set of things, and then the stigma of having a bag and tube and a J tube. So yeah, that's kind of my life in a nutshell.
Thank you so much for sharing, both of you. I am kind of struck by how different your conditions are, and yet there's a lot of similarities in, yeah, their original interactions with the healthcare system and needing to advocate for yourselves and having those people there for you to do that with you. And I'm glad both of you have been able to get those answers and have that advocacy behind you. Um, it sounds like we've talked a little bit about what treatments you guys have tried, but is there anything else that you think is notable, worth talking about? What has worked, what hasn't? If there's anything unique that you've tried that even just to alleviate symptoms that you might want to share?
I think for me, celiac disease, kind of similar to your case, it also can cause various other complications. So for me, it ended up causing GERD. So acid reflux basically consistently, and as well as I'm still semi-lactose intolerant. And honestly, my biggest things that have helped me is just having a heating pad on hand. You can even ask, like if you go to a hotel and if they don't have a microwave in the room, you can usually ask for one and they can bring it up. Or I've even had them like throw the heat pack in their worker microwave where I'm like, I just need it to fall asleep. I promise, please. And they'll do it for you. People can be very nice. And I think also just trying to do a lot of teas when I am being glutened, and just keeping in mind, I know, especially hearing Larry's story, that I am grateful that I can experiment with a lot of gluten-free foods. and turning myself into more of a foodie has kind of helped make the restriction feel a little less limiting. So that's kind of one of the silver linings of celiac that I am grateful for.
I would have to say for myself is that you know your own body. So doctors only know what they've either read in a textbook or what they've seen in another patient. They don't know what it's like to live in your body. So based on their experience, they know what to recommend to you. And, always follow the doctor's guidelines, but also understand that they only know so much. And so try not to limit yourself and do your own experimenting. Because they may say, hey, there's a list of 50 things that you can't do. But if you go and say, well, why can't I? Can you at least explain to me why? Um, you have to do what's best for your body. So for me, it's it was always, when you're on TPN, absolutely no food, nothing by mouth. That is very, very, very restricting for someone, and it can be very, very demoralizing. Um, and so for me, it was, will you give me the grace to try things when I feel I'm equipped? And if I've gone too far, I have to pull back. And so again, this goes back to your own body and allow yourself to experience knowing you might have a setback. Um, but that trial may give you the freedom to go a little bit further and have a better quality of life. So for me, it wasn't the medication, it was having an understanding with the doctor of, listen, we both have our own limitations of knowing what's going on with this disease. Um, and I would say not many doctors know my specific situation. So even some of the best Cleveland Clinic, the best GI surgeons and best GI team in the world, they don't have a patient like me that has been through these exact steps. So they know they're comfortable enough to say, Larry, if you're willing to try a piece of fruit, just go for it. But no, if vomiting happens or something like that, hey, it's time to scale back. Or if it's setting well, go for it and keep going.
Yeah, I think that's really powerful, that you know your body best. And while obviously with the support of the doctors and figuring out what that might look like for you, these conditions are chronic. They impact your life in a very severe way. And so figuring out how you can kind of marry those two concepts. Yes, I have to deal with this condition every day, but also I am my own person. I have my own needs. I have my own wants. And finding what works best for you, I think that's really powerful. And you both have touched on that quite a bit. So I'm happy to hear that you have both had success in figuring out things like either gluten-free foods that, hey, this is actually pretty good and it doesn't taste rock solid like some gluten-free food does, or, maybe I can play around with what I can eat when I'm on TPN. That's wonderful to hear. I know you both have also talked a lot about impactful experiences that you've had, but I was wondering if you might be able to share well, if you had to say what one of the most impactful experiences that you've had in your journey would be, what would that be? Um,
Honestly, one of the first things that comes to mind, I would consider one of the first acts of kindness that someone did to me or did for me with celiac was when I went to college. I'd already committed to a college, so I wasn't able to really make gluten-free part of my college choice. And at my particular college, freshmen could not have cars. So I was kind of stuck in this place where I could maybe walk to get food places or try to get an Uber. I think those were back in 2013, or try to catch a bus. But I had one professor in the college who also happened to have celiac, and she heard about me. And I had just one class with her, and she offered just to drive me to the Sprouts across town, like one afternoon, so that I could find like a bunch of new things that I hadn't seen before, just really stock up my dorm. And I just remember feeling so grateful that someone thought to offer that act of kindness just because we had the same condition and happened to be in the same place. And I think that act is also constantly reminding me that helping someone doesn't have to be like this huge tremendous effort. Yes, it's amazing if you can spend, days or years looking into medical research to help your loved one, which I hope most people would be willing to do. But sometimes it can also be as simple as just, offering someone a ride or asking what they could eat for dinner that would be safe for them, what they would be comfortable with, or just keeping in mind like what they need to feel seen and to be loved, even however their condition makes them live. And that's just the first story that pops into my head.
I would say for me, it was actually the first interaction that I had with Cleveland Clinic in 2019. It was because we had been through so many doctors and so many surgeries and had been told that the road was over. The first time meeting with that transplant team, they had actually told me, "You are not unique when it comes to your condition. We've actually treated patients like you before." It was actually a glimmer of hope of like we didn't hit the end of the road, and their entire job day in and day out is to deal with complicated cases like mine. So it gave me that find like I'm in the right place. Things are going to get better. And it truly, if it wasn't for them, I wouldn't be sitting here today. Even though they've done two major surgeries, each time they've done that surgery, my quality of life has improved. So has it drastically changed? Yes. But for me, again, it goes back to continuously advocating for yourself. And even though one person says that this is the end of the road, doesn't necessarily mean it's the end of the road. Keep fighting for yourself because there are 9 billion people on the face of this earth. I'm sure that there's someone who's just like you, suffering the same way, meaning that there's also medical teams that are dealing with someone exactly like you, or at least similar, that can advocate for you.
I love that sentiment that there's a goodness in not being unique, that you are understood and that there are other people around you who can help you either through a drive or through medical care. And I think it really pushes how important that community can be. So we've talked a little bit about some struggles that you guys have experienced in healthcare systems, especially early on in your journeys to diagnosis. You can feel free to expand on those, but we're also curious about whether you guys have faced challenges in education systems or workplace systems in terms of receiving support or lack of. I know, Casey, you did mention getting food being a difficult thing for you. Are there any experiences that you guys would like to share on that front?
I definitely think college is not easy with dietary restrictions. It's certainly easier nowadays than it was back in 2013. I know there are some colleges that have entirely, 100% gluten-free or food allergy cafeterias, and those are amazing options. And it was really hard that my first year, I basically had all of the chefs prepare my meal separately, which was such a blessing. But in order to do that, I would have to stand in a specific corner of the cafeteria for them to bring out my special meal. So we were kind of known as the 3 or 5 kids that, needed their special food. And because my doctor had given my cafeteria a note saying she can't be forced to eat a large amount in a short amount of time, she needs to be allowed to take food out of the cafeteria, which wasn't typically allowed. They thought it was a good idea to plaster my face like on the exit podium of like, this girl is allowed to take out food. So that was not necessarily, I hated the option, but it also didn't help me feeling different, especially because it was a very small school. So everyone knew when I was hospitalized. Everyone could see that I was struggling because I was very underweight. But another aspect I would say for anyone with celiac or dietary restrictions is also the relational challenges. I, in particular, had one partner's mom who was extremely toxic. She just thought that I was making up celiac for attention. She would tell me when we're in restaurants, like, oh, you're being too extra to ask about a dedicated fryer or to tell them that you don't have cross contact. she asked my boyfriend, have you seen her medical records? Like, is she lying? And I'm like, well, everyone's seen me hospitalized, so I wasn't lying. But I think it can be really challenging when you encounter people who take your diagnosis personally and feel like you are making it up for attention when most of us would never wish for this condition ever. And I think that that was a very character shaping moment where I just had to accept that some people are not going to like me because of previous stereotypes they have about my condition. And hopefully, most people, you will be able to educate them and they will be open to learning and open to changing their opinion. But there also comes a time when you need to recognize that your energy and your positivity cannot sway everyone, and that sometimes you just have to let people go and know that maybe one day they will not learn, maybe they won't, but it's not your problem.
I have the same sentiments as Casey does. For me, I was before I went on disability, I was a business consultant. So I had to travel the country, and at the time, I had already had the feeding tube. I was still able to have some oral intake, but it would ultimately make me sick pretty quickly. And as a consultant, you have to take your clients out to dinner quite a number of times. So that became quite the challenge. And then in 2019, before I went on permanent disability, um, I was given the ileostomy. Well, with an ileostomy, you can't necessarily tuck in your shirt, so wearing a suit became very difficult. Um, I will tell you, for me, the biggest challenge is a public restroom. It is, honestly, it's actually humiliating. In a male restroom, 9 times out of 10, it's not very clean, not very sanitary. And the way my ileostomy is positioned on my body, um, you can't sit to be able to empty the bag. So you have to get on your knees to be able to do that. And so it is an extremely difficult, dehumanizing experience to be able to have to do that in a public restroom. So I hate going to a restaurant or even into a public setting that I know that I have to use the restroom. And still to this day, don't tuck in my shirt, and I will do everything possible to make sure my my food is timed so that I am not having to use a public restroom. Um, I don't know if I'll ever be able to get over that. Again, it's been, 6 years since I've had that. Um, with family and friends who know that I have this gift I call it a gift of life, that that we can work around it. But most people don't really understand what it's like to have that stigma. So I can sympathize with Casey when she says, she has her name plastered or her picture plastered in a cafeteria. You feel the same way when you may not know what's underneath my shirt, but when it's time to use the restroom, or as my kids joke, that dad's bag is tooting. It's funny when people around you can understand that, but when you're in a public setting, it's still, even though it's something that saved your life, it's still very hard to grasp what's going on.
Yeah, thank you both for sharing so much. And I'm sorry to hear that you both have had such negative experiences. It is unfortunate that a lot of times society they think that they are trying to help, or they don't see the ways that they're missing. They're they're not helping people in an equitable way. They don't see how this might be an issue or how they could better support people who do have disability or chronic issues. So again, I'm sorry about those experiences, but um, I'm happy to hear that you both have found some workarounds and have been able to make it a little bit better for you both. Our next question here is about misconceptions related to your condition. Have there been any specific misconceptions that you have encountered? And if so, how can we challenge those? What is incorrect about those misconceptions that we can learn from?
I think probably the largest misconception about celiac disease is that you just get a stomach ache or that it's something like lactose intolerance, where it's like, okay, you're going to go blow up the bathroom for a bit and then you'll be fine. When it's like, no, we can have rashes, we can have brain fog, we can have fatigue. Personally, I get horrible insomnia. So I just call it kind of feeling zombified, where I'm just constantly tired through the day and can't feel like I think straight. And then at night, I can't fall asleep. And I think there's also a big misconception that everyone with celiac looks malnourished pre-diagnosis and that they're only having digestive issues, when recent studies are actually finding that more people with celiac disease nowadays actually have atypical celiac, which would include symptoms like rashes or neurological symptoms or any symptoms that are not related to just plain weight loss.
So for me, even though I have all of these comorbidities, if you will, I can still, the misconception is I can still have a normal life. I can still do, there are some limitations, but I can still go out and get together with friends. I can still swim. I can still go on trips. Uh, Albeit there are some limitations when it comes to restrooms and eating and food, and going through something like TSA. But all in all, living with conditions like ours, uh, even though they can be debilitating at times, we still can live a very fulfilled life. Um, it takes us a long time to probably adapt and to learn ourselves, but once we get the hang of it, I think a lot of people, at least for me, will see us as scary or taboo, or let's not talk about it, or let's not bring it up, or we don't want to bring the person down. And it's for me, is if you're willing to ask, I'm willing to give back. You're not going to offend me. Actually, by me sharing my story, it brings more awareness, because there are other people who are suffering in silence. Uh, my sharing my story is, on my socials, is I may have a challenging life, but I also have a very fulfilling life. And if my suffering is meant for anything, it's I want other people to see, hey, whatever you're suffering with, you can still have a very fulfilling life. And you can fulfill others by empowering them uh, to live out their illness or to live out whatever they're suffering from, whether that's mentally or physically. Um, it takes us a while to adapt and it takes us a while to learn ourselves. But the more that we can empower others, whether that it's in the medical field or social media or just in the public, simple thing is going, needing a restroom or needing assistance in a restroom. It's somebody who's never experienced ileostomy or a J tube or dietary restrictions. You're in that moment, you're educating someone. I'll briefly share something. We came back from a trip to France 2 summers ago, and we were coming through LAX, and I was going through regular security at LAX in order for our domestic flight to come home. And because I think it was a belt that I was wearing, I went off. So then they had to do a pat down. Well, they decided to do a pat down and they came across my abdomen. And as soon as they hit the abdomen, he said he touched it. And I said, and he goes, "What is that?" And I said, "It's an ileostomy." He goes, "Ew, that's disgusting." And of course, for me, that is actually my biggest fear, was somebody to call me disgusting. In all of my years, that was one of my biggest fears of having this. Um, And the misconception with an ileostomy is it stinks, it's messy, it's gross. It's none of those things. It's actually contained. You don't smell it. But immediately, as I was crushed, my wife heard that, and her immediate response was, "That saved his life." And then a supervisor was called over and was saying, you know, "That might be disgusting to you, but that saved his life. And actually, you touching that, There's no contamination, there's no disgust. But that's again, it's the public not knowing and not knowing you're talking about a human being and you're talking about something that you don't know the backstory of. So for me, I'm telling you right now, our journeys they may be a struggle for us right now, uh, but in both of our conditions, our hope is that it helps somebody in the future.
Thank you, both of you. That was incredibly powerful. Still digesting that a little bit. I think you both have hit kind of the nail on the head of what invisible illnesses mean, where you can look like everything is, for lack of a better word, normal, but there's still this intersection where you have to explain yourself. And there's this divergence from the normal that is put in your hands to explain. And I really hope that by expanding this message and by talking about these things more, we can help mitigate that and help take the burden of those explanations off of your guys' shoulders. Um, so our next question is regarding someone else who might be diagnosed with the same conditions that you have. What advice would you give them if they were just diagnosed or suspecting of having what you've gone through?
I think one of the most important tips, if you suspect that you have celiac disease, please don't go gluten-free before you get tested. There is a new test that is being developed now that doesn't require you to be eating gluten to have accurate results for celiac, but that's not in hospitals yet. Right now, the only test for celiac disease requires you to be eating gluten, and unfortunately requires you to have an endoscopy and a biopsy that shows the actual intestinal damage that you're experiencing because of gluten. So that would be the tip if you suspect you have celiac. Get tested. It starts with a simple blood test, and then it's usually confirmed through an endoscopy, sometimes also a colonoscopy with a biopsy of your intestines. But kind of going off of Larry's message, which was so powerful, I think the biggest tip I would give someone who's newly diagnosed with celiac is that it will get easier. I still have to think about gluten, every day, even 12 years later, but I think about it so much less than when I was first diagnosed. And it will feel overwhelming, especially if you are starting from scratch. I would recommend sticking to a lot of naturally gluten-free meals with some of these new gluten-free products on the side because, yeah, some do taste like cardboard. You're going to have to do some trial and error to find the ones that you really like. So it can be really helpful just to stick with, like meats, veggies, fruits, and then have those new crackers on the side. So even if you hate those freaking crackers, you still have food. You can still have a yummy meal. And I think it's also important to know that gluten-free food is so much better than it was even when I was diagnosed over a decade ago. It's still only getting better. And there are, I believe, 20 plus different studies and treatments that are being looked into for celiac now. So a gluten-free diet is our only medicine for now, but it may not be forever. So just keep in mind that your life will be different, but it can still be amazing, even while eating gluten-free.
For me, I'll go back to saying, uh, you know your body. So you know when something is wrong and something is not right. And a lot of times, especially for my cancer diagnosis and the gastroparesis diagnosis, it took many, many months to figure out what was going on and many doctors to figure out what was going on. And it was, again, it was misdiagnosis after misdiagnosis after misdiagnosis. And I think, especially the way that the medical field is going today, is doctors are overburdened, hospitals are overburdened and overstaffed. And if you do not keep up on your own medical records, on your own medical testing, you will fall through the cracks. Now, 14 years ago, it was a little bit easier. It was a lot more difficult, I think, to fall through the cracks. You still had to advocate for yourself. But today, it makes it even more difficult. If you're not calling your doctor don't wait for them to call you, you call them. Because a lot of times, especially with these specialists, it can take months to get in if you don't get in as quickly as possible. And if you're suffering and you're not getting the proper diagnosis, just do yourself the favor and minimize your suffering as much as possible and advocate for yourself. If you know something is wrong, and do your own research. And, I don't want to plug AI very much, but chat GPT a little, if you need to. Um, but ultimately, uh, just even if it's simple as keeping a journal of how you're feeling, like, hey, this day something was awry. I don't know if it was because of something I ate or, something looked a little different, because it's a lot easier to reference when you're in front of a doctor instead of getting a lot of people, okay, MD fright. And you're in front of the doctor and you say, I have all these things going on, but I can't recall when or where or how. Um, so the more information you have to be able to advocate for yourself, the better. And I think that's probably the biggest thing I could share is be in tune with yourself, because you will know when something is wrong and when you need that medical attention.
Thank you both again. Very, very powerful. I love the whole theme of advocacy tonight. And obviously that's what we really try to champion here through this platform. But you both have harped on it so much about, again, like figuring out, like you know yourself best, you know what you need, figuring out what you need for your lifestyle and how to manage your condition within that. And I think it's very powerful what you said too, Larry, about, keeping journals. And I have a friend who has celiac disease and she does that as well. I'm not sure if Casey, you have any experience with that, but keeping these food journals, especially when it comes to these GI conditions, can be really, really valuable. So I hope that anyone who's maybe watching this or listening can maybe look into that as well. But within that, so you can present it to your doctors and be your own advocate. I love that as our main theme for tonight. So that said, I know we are getting close to 9, so I think we're going to go ahead and wrap it up. Thank you again, both so much for speaking. This was an incredible conversation, and I learned so much. I'm sure everyone else did as well. So please, everyone who's listening, make sure again to check them out on social media. You can reference the links as seen on the screen. And then earlier in the call, I did read them out as well. Regarding our announcements. Oh, sorry. If we do have any questions in the meantime, please feel free to throw those in the chat. But I'll go ahead and say our announcements. So for our next meeting, we will be having that on September 17th, and that meeting is going to be about chronic pain. We're hoping to talk about fibromyalgia, complex regional pain syndrome, and craniocervical instability. So please follow our social media and sign up for our email notifications to also get the announcement of any additional dates and further meetings beyond our September 17th date. And then lastly here, we just have our credits again. Again, you can follow us on social media. And then our website, iiannetwork.org. That is where you can, again, register for our newsletters. And there's a QR code with the link tree for you to access those links more. We do have our YouTube channel. It is at IIA Network. Again, if you access that with the link tree right there, it should be able to take you to the link directly, or again, you can visit our website for that as well. Thank you so much again, everyone, for joining and for everyone who's watching this video. And thank you so very much again to our wonderful guest speakers tonight. We really appreciate everything with us, and it was so lucky to have the opportunity to learn and hear from you both. Sorry.
Thank you for having me. I appreciate the time.
Thank you so much.